Our case study today is about Patrick. Patrick is a 78-year-old male who is experiencing respiratory distress. Patrick is very tired, has a regular cough, and suffers from dyspnea. His legs are swollen from the knee down and has chronic obstructive pulmonary disorder, also known as COPD, and worsening of his left-sided heart failure. By looking at Patrick's current health, medical history, and clinical data, we can determine the contributing factors relating to his respiratory symptoms. What are the cause of Patrick's respiratory symptoms? Patrick's respiratory symptoms include a regular cough and dyspnea resulting from his current diagnosis of COPD and left-sided heart failure. COPD is a combination of chronic bronchitis and emphysema. COPD results in the loss of mucociliary escalator mechanisms, therefore resulting in an increase of mucus production and loss of cilia in the bronchioles. These cellular changes are what provokes Patrick's recurrent coughing. Emphysema is a disease resulting in the breakdown and loss of the alveoli, causing a decrease in oxygen saturation, which also contributes to the symptoms of dyspnea. In Patrick's case, his COPD was caused from having a previous history of smoking between the ages of 20 to 60 years. At age 68, he endured a myocardial infarction to a branch of his left coronary artery, which resulted in left-sided heart failure. Left-sided heart failure causes circulatory effects such as pulmonary hypertension, which is the backflow of fluid from the left atrium into the lungs. Pulmonary hypertension can also cause persistent coughing and dyspnea. What factors contribute to Patrick's heart rate? Patrick's heart rate is currently 155 beats per minute, which is sitting above the normal range for an adult male, which is 60 to 100 beats per minute. Patrick's increased heart rate, or tachycardia, low hemoglobin count, and dyspnea are all symptoms of hypoxemia. Additionally, COPD causes a lack of oxygen in the blood, which results in an increased heart rate, which is due to the heart having to pump further oxygenated blood around the body. This can also be confirmed by looking at Patrick's blood test results, which show decreased levels of hemoglobin. Decreased levels of hemoglobin essentially means the body is not getting enough oxygen, which brings on symptoms of fatigue and weakness, or in Patrick's case, decreased mobility. COPD and left-sided heart failure. COPD is the chronic obstruction of airflow into the lungs caused by increased mucus and inflammation, as well as the loss of cilia. As previously stated, Patrick's COPD was caused from his previous history of smoking. However, additional factors include his predisposition from being male, his high BMI of 29.3, and his mature age of 78 years. Left-sided heart failure is when the left side of the heart fails to contract efficiently, causing systolic dysfunction and diminished ability to eject blood due to impaired ventricular contractility and increased afterload. The right side of the heart will also suffer from impaired diastolic function, which causes impairment to both the relaxation and filling function of the ventricles due to an increase in stiffness in the ventricular wall. Additionally, COPD results from an abnormal immune response, which causes an increase of inflammatory markers such as leukotrienes, cytokines, and chemokines. The high levels of these compounds are the cause of inflammation or damaged airways in chronic bronchitis and the destruction of lung tissue in emphysema. Due to the prolonged physiological changes that the body endures to compensate for the damage of the left side of the heart, the muscle walls of the right ventricle hypertrophy. In Patrick's case, his left-sided heart failure results in the inability for the left ventricle to pump efficiently. Although left-sided heart failure is not directly related to COPD, both correlate to one another. A common symptom of COPD is a decrease in oxygen levels in the blood, which places extra strain on the heart, therefore worsening left-sided heart failure. Left-sided heart failure often causes a backflow of blood in the alveoli of the lungs, which makes breathing difficult, and in Patrick's case, his COPD symptoms of dyspnea. Is Patrick at risk of developing right-sided heart failure? Left-sided heart failure can directly cause right-sided heart failure. Right-sided heart failure is the result of pulmonary edema, right ventricular hypertrophy, or RVH, and impairment of systolic and diastolic functions. Pulmonary edema occurs from blood pooling behind the left ventricle into the left atrium and into the lungs, which eventually overflows and pools into the right ventricle. Over time, the right ventricular muscle walls attempt to overcompensate for the left-sided heart failure by increasing in muscle mass, which is known as right ventricular hypertrophy. As the right ventricle increases in workload, it places additional pressure and stress on each contraction during ventricular filling and ejecting. This increase in workload makes the right side of the heart more susceptible to failure. As the right ventricle is considerably smaller than the left ventricle, the result of RVH can block the blood supply to the right ventricle by essentially narrowing the pulmonic valve. RVH also impairs contractility of the systolic function, subsequently decreasing cardiac output, as well as impairment of the relaxation and filling mechanisms of the diastolic ventricular pressure. Upon review of Patrick's blood test results, it is evident that all of Patrick's values are either significantly above or below the healthy reference range given. Reflecting on these results, we can interpret how these may have occurred and how this can be affecting Patrick. Sodium, potassium, calcium. Sodium, potassium, and calcium are electrolytes, and in Patrick's case are all reading abnormally. The sodium levels are shown as 150 millimoles per liter, which is considerably high, placing it in the hypernatremia range. The potassium levels are also elevated, reading at 5.2 millimoles per liter, which falls into the category of mild hyperkalemia. Patrick's calcium levels, however, display a low value of 2.05 millimoles per liter. Calcium levels below 2.1 millimoles per liter are defined as hypokalemia. An electrolyte imbalance can be caused by medication interference or loss of bodily fluid. This imbalance, however, can also at times be a biomarker of kidney failure. Patients with progressive heart failure, such as Patrick, are commonly found to develop kidney dysfunction or failure because they share many pathophysiological pathways, namely fluid intra- and extracellular volume homeostasis. Potassium within the body must stay at a constant level to maintain homeostasis. If there is a significant increase or decrease of potassium levels, there is a decline in respiratory function and alteration of contractility within the heart. A high potassium level is the most common symptom of kidney failure. Heart failure can impact several mechanisms in the pathogenesis of the renal system, namely the hemodynamic mechanisms of glomerular filtration rate, or GFR, and renal plasma flow, also known as RPF. As GFR and RPF are reduced, cardiac output becomes impaired. The kidneys experience hyperperfusion, and the volume of blood exposed to renal filtration is dramatically reduced as the pressure gradient can no longer be maintained over the entire length of the glomerular capillary into the Bowman's space. Therefore, sodium and potassium are no longer able to be filtered and excreted efficiently by the kidneys, which leads to a significant buildup. Similarly, the kidneys are no longer able to convert vitamin D into its active form. The body needs to absorb calcium, otherwise resulting in hypocalcemia, which in turn leads to renal failure. Muscle spasms and aches are the earliest signs of an ongoing calcium deficiency. As hypocalcemia progresses, patients can often become fatigued, confused, depressed, and forgetful. If Patrick were to have renal failure, the high level of sodium retention would explain the peripheral edema. Hemoglobin. Patrick's hemoglobin count is 111 grams per liter. This is significantly low for his age and defined as anemic due to the low levels of iron. When kidneys are diseased or damaged, they do not make enough erythropoietin. As a result, the bone marrow makes fewer red blood cells, causing anemia. When blood has fewer red blood cells, it deprives the body of the oxygen it needs to function correctly. This causes fatigue and weakness, and in extreme cases can cause respiratory distress and hypoxia. Triglycerides, high-density lipoproteins, and low-density lipoproteins. Triglycerides are the stored form of fat within the body. A large portion of triglycerides are found within adipose tissue. Though some do circulate within the bloodstream to provide fuel for muscles to work. Due to Patrick's high triglyceride level of 4.2 millimoles per liter, it is more than likely he also has high cholesterol. Patrick's low-density lipoproteins and high-density lipoproteins are abnormal, with LDL being too high, showing a reading of 3.5 millimoles per liter, and HDL levels being too low, with a value of 0.8 millimoles per liter. Triglycerides, LDLs, and HDLs contribute to the risk of heart disease and kidney failure. When the endothelium becomes damaged, the body sends out an inflammatory response which attracts LDLs, phagocytic cells, clotting proteins, mast cells, and other immune response cells, which accumulate at the damaged site within the arterial muscle wall. Macrophages send chemical signals to recruit more phagocytic cells, which result in a rapid influx of macrophages, causing these to maturate into foam cells. Over time, the buildup of cholesterol in macrophages hardens and further narrows the artery, which in turn restricts or eventually blocks blood flow. This progression of plaque buildup is called atherosclerosis. Glucose. The brain and nervous system rely on glucose for energy and can only function correctly if levels within the blood remain within a certain range. In addition, insulin controls the transportation of glucose into cells. Patrick's glucose results display a high fasting value of 8.5 millimoles per liter, which is defined as hypoglycemic and falls within the category of probable type 2 diabetes readings. This may be due to a low level of insulin and even insulin resistance. An increase in glucose levels can lead to severe damage of the kidneys, eyes, blood vessels, heart, and nerves. Overall, Patrick's blood test results could be an indication of possible progression towards renal failure and worsening heart failure. Renal failure can affect neurological function in a variety of ways due to lack of nutrients and oxygen circulating the body. Possible neurological complications include cognitive impairment, typically manifesting as vascular dementia, and uremia, which can cause functional disability and an altered mental state. Creatine testing. When a compound called creatine breaks down in the muscle, creatinine is produced. Creatinine is used within the body's cells to produce energy and is needed to contract muscle. Creatine is excreted by the kidneys and is used to determine how effective the kidneys are filtering small molecules out of the blood. Creatine levels within the blood or urine can indicate if Patrick's kidneys are functioning properly. By testing for this, the results will show if Patrick has type 1 or type 2 diabetes, a kidney disease, or if his past medical history has affected the productivity of his kidneys. The normal range for creatinine within the blood is 0.84 to 1.21 millimoles per litre. Increased levels suggest that Patrick may have acute kidney failure due to reduced blood flow to the kidneys from having atherosclerosis. Thank you for watching. Remember to tune in next week as we explore our first neurological podcast entitled, I Wasn't Going to Get a Brain Transplant, but then I changed my mind.